health is so important. It's really something that we need to talk about, and specifically prostate health is what we're going to focus on today. So we have Dr. Douglas J. Rivera on the line. He is a board-certified radiation oncologist and the medical director at Austin CyberKnife. Good morning, Dr. Rivera.
Good morning. Good to see you.
Good to see you too. Usually lovely to have you in studio, but we have to do telehealth, right? Telemedicine's very big, so look at us. We're trying the socially distanced way of interviewing as well.
That's
Dr.
right.
Rivera, let's try first and foremost to talk about prostate health and why it's so important that we talk about it and that we bring some awareness to it.
Prostate cancer is the most common cancer that occurs in males, and it's the second leading cause of death in cancer. Cancer being the second, leading cause of death in general for people. So therefore, you can see that the numbers are huge in terms of how many people can be affected by this.
I did not know that the numbers were that high. So let's talk about some of the risk factors for men who might develop prostate cancer.
Well, the number one risk factor is related to almost all cancers, and really it's age, believe it or not. As our cells grow and divide, the more time that happens, a mistake can happen. So really age is the largest thing, and that's why screening begins for most folks the age of 50, sometimes 40, depending on things like family history as well, which is also important. Modifications of diet and exercise and those type of things we can do to prevent it. But really, age and family history are two of the strongest indicators of whether you can get prostate cancer.
So don't start slacking off on those doctor's visits as we get older, is what I'm hearing. Maybe increase the amount of time you spend with the doc, just checking in. Sounds like a good idea. Let's talk about signs and symptoms, because I was really surprised to hear you say that so much of what happens with prostate cancer is that people can be asymptomatic for a long time, and that can lead to some scarier results.
If one wasn't to get screened, what happens is the tumor grows in the prostate, or they generally get kind of urinary symptoms, not very specific, but can be things like not peeing as well, the stream is reduced, maybe you can have some burning when you urinate, maybe some discomfort down there. And then as things go, much further along and it spreads outside the prostate, which a lot of cancers can do, then it goes to places like the bones or other parts of the organs that can cause pain, weight loss, and all these other things we think about with advanced cancer. If we do catch it early and it's contained within prostate, it can be cured with high rates. And it is the most common cancer, as I mentioned, for men, but it's still the second most common cause of cancer death in men as well. But that being said, a vast majority of folks do not die of prostate cancer because they're either are cured or their prostate cancer is so slow, and that in some cases we can even just watch it depending on age and other medical factors.
And a treatment path that not a lot of people know about, especially here in Central Texas, because you guys are the only ones who do it, is CyberKnife. So tell me a little bit about CyberKnife, how it works, and then how you guys would use it to treat prostate cancer.
CyberKnife is a special machine that we can treat prostate cancer with. Some of the benefits are that it's very, very precise, and we can treat the prostate cancer and get very good results. We can do this in about 3 to 5 treatments. In general, 5 treatments is the course. In more traditional radiation courses, we talk about 9 weeks of treatment, 45 treatments, for example. Really a benefit to our patients, both now, but also in the future as well.
I think that it's incredible that so much brain power has gone into making this machine. Also, the fact that there's no downtime, and if you're scared of needles, it's not invasive too, right?
That's exactly right. So our patients, can bring themselves into their visits. They don't need to necessarily come with anybody, and they can even work during this whole process. I mean, it's not something that requires significant recovery. They don't have to go into the hospital, which is another risk factor we're trying to keep people from. So it works out quite nicely.
Man, it sounds like you can really maintain an independent lifestyle while doing this, because if you get sick, you feel like you have to start leaning on your social net. But speaking of your social net, you guys are trying to connect people kind of emotionally, because you've started a Facebook group for people to talk to each other if maybe they've just received a diagnosis and they need to chat with someone.
Sometimes they just need to hear it from other people who have went through it. People can get through that through our website, Austin CyberKnife, and go through the Facebook page and really connect with people who have had prostate cancer, many of which have had this type of treatment, and can talk to them about some of the concerns they have. I hope that my patients feel like they can ask me anything, but you'd be surprised. Sometimes they just feel more comfortable talking to people who have been through it or about to go through it.
And of course, you guys are there to help them medically all along the way. And doctor, I know you've been popping in and out of appointments even while you and I have been talking. So you're a very busy man. We appreciate you taking a couple minutes out of your day, and we hope to see you in person again soon.
Likewise. Thank you.
Austin CyberKnife is located on I-35 near the Del Seton Medical Center at the University of Texas. Call them at 512-324-8060 or go to austincyberknife.com.